At the Integrative Cardiology Center of Long Island, we practice holistic cardiovascular medicine, or as we call it, healing the hearts on fire. What is holistic cardiovascular medicine? Dr. Drew sees it as a combination of conventional, integrative, and functional medicine approaches. While conventional medicine commonly provides medications, procedures, or devices for cardiac care, integrative medicine has been shown to be of help in cardiovascular conditions through mindfulness-based stress reduction, acupuncture, or lifestyle modifications. Finally, functional medicine that creates matrix to evaluate a person's imbalances and provides us with timeline and root causes is of essential benefit to cardiovascular patient or patient with risk factors. In functional medicine, we use a model of antecedents, triggers, and mediators, or ATMs. We know that multiple factors, things such as nutrition, sedentary lifestyle, chronic stress, poverty, aging, indoor living, fragmented family and communities, and environmental toxicity can contribute to the occurrences of chronic diseases. Cardiovascular disease is a number one chronic disease, a top reason for mortality in both men and women. We also know that one condition could have many imbalances. For example, obesity could be explained by situations or clinical imbalances that involve inflammation, hormonal imbalance, genetics and epigenetics, diet and exercise, or even relationship with the mood disorders. At the same time, we know that one imbalance could potentially create many conditions. For example, inflammation is a very important imbalance that significantly impacts heart disease, depression, arthritis, cancer, diabetes, and a lot of other chronic diseases. So in functional medicine matrix, we create and assess a set of factors to personalize your treatment. Assimilation, defense and repair, energy, biotransformation and elimination, transport, communication, and structural integrity are essential components of the matrix. Very importantly, we'll look at mental, emotional, and spiritual life of an individual to really understand how these will factor into development of vascular diseases. On the molecular level, vascular disease is driven by inflammation, oxidative stress, and autoimmunity. These main drivers serve as antecedents, triggers, and mediators in the functional medicine model. We modify personal lifestyle factors, sleep and relaxation, exercise and movement, nutritional profile, ability of individual to withstand stress or stress resilience, as well as their relationships. Two simple questions of cause and function are important components of your evaluation at the Integrative Cardiology Center of Long Island. Does this person need to be rid of something, whether it's toxic exposures, allergies, infections, inflammatory influences, poor diet, or stress? Or, and perhaps maybe together, does this person have some unmet individual need that is required for optimal function? We create a model that uses genomic testing, environmental testing, assessments of nutrition, exercise, and provides foundational and condition-specific supplementations. The model addresses key areas: metabolic, hereditary, hormonal, stress and sleep, toxic, and probably the most important area of what we call 3 I's: inflammatory, immune, and infectious influences. These clinical areas allow us to uncover imbalances in immunity, oxidative stress, and inflammation that occur on a molecular level and manifest themselves as clinical atherosclerosis or propensity for atherosclerosis. Our landmark program called Fit in Your Genes uses genome, environment assessment, nutritional plans, exercise, and supplements to shift the balance in your favor and rid you of metabolic imbalances. Whether you're using it in a standard cardiac domain in a variety of patients who may be suffering from arrhythmias, congestive heart failure, coronary artery disease, or even pre or post procedure, the model is suited to address every single facet of cardiac care by focusing on the essential components of stress and sleep, metabolic disturbances, toxic exposures, immune and inflammatory influences, hormonal and hereditary parameters. This truly is holistic cardiac care. We look at the variety of laboratories, genomic markers, use a variety of nutritional plans, and use supplementation in conjunction with your nutritional plans to address the metabolic imbalances and provide what you might be missing. A word on cardiogenomics. Cardiogenomics is a fairly complicated area. We use it in conjunction with pharmacogenomics, which evaluates your response to various cardiovascular medications, nutrigenomics, which evaluates your propensity to respond in a certain way to dietary nutrients, supplementations, as well as your metabolic variability measurement, and epigenomics, which gives us an understanding of behavioral and environmental factors that may be affecting your health. Why do we do this? I personally do this because I believe that each and every one of us, when confronted with chronic illness, is at the fork in the road. And actually, as a population in this country, we have noticed that the cost of care, medical care, and majority of these expenses are driven by chronic illnesses, with cardiac disease being number one. This cost currently exceeds $3 trillion a year. We have noted that there is decline in generational health for the generation of children growing up now expected to live less than their parents. And we are absolutely engulfed in the epidemic of chronic diseases. We know also that food as medicine is a powerful concept, and it's capable of preventing 80% of chronic diseases that we see down the line. So our belief, our firm philosophical framework at the Integrative Cardiology Center of Long Island, that our destination is health, and we should get there by switching our path. And that path would emphasize food as medicine, would emphasize disease prevention, and would lead us to the future, which is health.